Environmental health for 5th semester students of the Faculty of Medicine. Environmental health. Environmental health for semester 5 is a course that explores the relationship between environmental factors and human health. In this course, students will learn how various aspects of the environment, whether physical, chemical, or biological, can affect public health. The course also discusses measures to protect and improve environmental quality to prevent diseases and create a healthier living environment. Here is a detailed explanation of environmental health taught in semester 5-1. Basic concepts of environmental health. Definition of environmental health. Environmental health refers to efforts to maintain the quality of the environment that affects human health, including air, water, food, housing, and working conditions. The main goal is to prevent diseases caused by environmental factors and improve human quality of life overall. Relationship between environment and health. Poor environmental conditions can lead to various communicable and non-communicable diseases, such as respiratory diseases, cancer, diarrhea, and even heart disease and mental health disorders. Factors affecting health include air pollution, water quality, sanitation, housing conditions, and waste management. 2. Environmental factors affecting health. Air pollution. Air pollution can be caused by motor vehicles, industries, fossil fuel combustion, and forest fires. Harmful substances such as carbon monoxide, nitrogen oxides, sulfur dioxide, and particulate matter, PM 2.5, can cause respiratory issues, asthma, bronchitis, and even lung cancer. Examples of diseases: asthma, chronic obstructive pulmonary disease, COPD, and lung cancer. Water quality. Water contaminated by pathogenic microorganisms, harmful chemicals, or industrial waste can lead to diseases such as diarrhea, cholera, hepatitis A, and skin infections. Examples of diseases: diarrhea, cholera, hepatitis A, and gastrointestinal infections. Sanitation and hygiene. Environments with poor sanitation, such as inadequate waste management or improper toilet facilities, can be sources of communicable diseases. Examples of diseases: helminth infections, cholera, dysentery, and typhoid fever. Soil pollution and waste management. Soil contamination by toxic chemicals or industrial waste can lead to acute or long-term poisoning, affecting human health, animals, and plants. Examples of diseases: lead poisoning, mercury poisoning, and cancer. Housing and living conditions. The quality of living spaces also affects health. Overcrowded, damp, poorly ventilated housing with poor sanitation can lead to health issues such as respiratory infections, skin infections, and even mental health disorders. Examples of diseases: asthma, tuberculosis, skin infections, and mental health issues. Climate change. Global climate change can increase the frequency of natural disasters such as floods, droughts, and heat waves, which impact health through malnutrition, infectious diseases, and psychological stress. Examples of diseases: infectious diseases, such as malaria, heat-related illnesses, and stress related to disasters. 3. Biological and social factors in environmental health. Pathogenic microorganisms. Many environmental health issues are caused by microorganisms such as bacteria, viruses, and parasites that thrive in unhealthy environments, particularly in contaminated water or food. Examples of diseases: diarrhea, malaria, cholera, and parasitic infections. Social and economic factors. Social economic conditions, such as poverty, education, and access to health care, can influence exposure to environmental risks. Poor communities are often more vulnerable to environmental pollution and have limited access to sanitation and health facilities. Lifestyle and habits. Bad habits such as smoking, alcohol consumption, and lack of physical activity can exacerbate the impacts of environmental health factors. 4. Environmental risk assessment and control. Environmental risk assessment. This process is used to identify, analyze, and evaluate potential health risks caused by environmental factors such as air pollution, water contamination, or hazardous chemicals. Risk assessment steps: hazard identification, dose response assessment, and risk characterization. Control strategies. Several environmental risk control measures include proper waste management, the use of environmentally friendly technologies, pollution control, and public health programs aimed at reducing the negative health impacts of environmental factors. Examples: limiting vehicle emissions, improving sanitation facilities, wastewater treatment, and promoting clean energy usage. 5. Environmental health policies and regulations. Environmental regulations. Governments play a key role in establishing regulations that protect environmental health, such as setting air, water, and soil quality standards, as well as waste management and sanitation regulations. World Health Organization, WHO, and environmental policies. WHO plays a major role in providing international guidelines on environmental health, such as policies related to climate change, air quality, and clean water management. Role of local governments and communities. Local governments and communities must collaborate in implementing policies and programs that promote environmental health. Empowering communities to maintain environmental cleanliness is also crucial. 6. Learning objectives of environmental health. Students are expected to understand the relationship between environmental factors and human health. Students should be able to identify environmental health issues and design effective control strategies. Students should be able to apply environmental health principles in medical practice and public health policies to improve quality of life and prevent diseases. Conclusion. The Environmental Health course in Semester 5 provides critical knowledge for medical students to understand and address health issues caused by environmental factors. This knowledge is not only essential for treatment but also for preventing diseases and promoting public health.